discussing, and it's actually a complication of thyroid disease. This is what is known as a Pendred syndrome. Okay, so they just said students should discuss the Pendred syndrome. So it's just a genetic disorder, and one of the key characteristics is there's thyroid problems, and you could also lose your hearing. Okay, there's thyroid problems, you can lose your hearing. Okay, thyroid problems and you can lose your hearing. So Pendred syndrome is an autosomal recessive genetic disorder. It's characterized by early childhood hearing loss, also thyroid dysfunction, that sometimes is affecting your ear. That's the inside of your ear where you are having the balancing apparatus. So it could actually also affect the the way you are balancing yourself. So key features is hearing loss. So it's often progressive, and the hearing loss actually worsens, okay, over time. So it's associated with inner ear malformations like enlarged vestibular aqueduct, and what again? Mondoni malformation. Those ones we'll discuss them later. Then there's thyroid abnormalities, like you're having an enlarged thyroid. I have the pictures here. So there's a goiter, So thyroid function may be normal or mildly impaired. Okay, so it rarely leads to hypothyroidism. It's just the enlarged thyroid that is the problem. Then you can also have a vestibular dysfunction where it will now cause you having issues with balancing, because the vestibular apparatus in the ear is what helps us to balance. So in the genetics, it's usually mutations used to a gene known as the SLC26A4 gene, also known as the PDS gene, as a Pendred syndrome gene, right? So diagnosis, usually check out for hearing loss. You see if the person has an enlarged thyroid or goiter. Okay, they also pick up if there's any family history of that particular condition. So for the hearing management, you use hearing aids or those cochlear implants. All right, avoid head trauma or barotrauma. Then for the thyroid management, you have to keep monitoring the thyroid size, okay, and all of that. Okay, supportive care is the speech and language therapy. Okay, so you have to counsel and the rest of it. Okay, so I think that's what we got for this. So I think that's what we got for the Pendred syndrome. Okay, genetic issue causing enlargement of the thyroid and also hearing loss.